it's said that a child's work is play, and so a big part of what we do is try to provide opportunities for children just to be kids while they're in the hospital, no matter what's going on. And so we just brought a few play items out, just trying to normalize the environment so that children can do what's typical for them that they would be doing at home, and so that they can feel comfortable, and that kind of opens the door for us to be able to build rapport with them and talk about some other issues or address other things that are going to be happening while they're at the hospital. Another role of Child Life Specialists is providing procedural support for children, and we do that in a variety of procedures. So when kids are getting an IV or NG tube, they're having a blood drawn, they're having a lumbar puncture, whatever it may be, going into sedation. And so a role that we have is providing that distraction for them while the procedure is happening. And so sometimes we use different tools like distraction items that spin and light up and make noise so that children, especially younger children, their attention can be directed to something else. Or the iPad is kind of a new tool that we use as well. Children can be playing games on this side while the other hand, and while they're getting an IV or blood drawn in the other hand, and it's a great way for children to be able to cope effectively with different procedures. And we do a variety of other things, whether it's singing and dancing, or telling stories, or playing a game, or we're watching something, or we're playing with other toys. It just depends per child and per procedure.
Part of procedural support, not only getting them through the procedure with distraction and helping them cope that way, we like to teach them a little bit about what's going to happen before, so they know what to expect. And we kind of go with what the child, how much they want to know. So we have different things that we can use. We have our teaching dolls with the different kinds of tubes and things like that, and we can, you know, take it apart and put it back together and involve the child in these experiences. Sometimes it's that it's a little baby who's having these procedures, so we have things that the parents can explore as well. So this is one of our G-tube babies, and this is something that gets used a lot on our general peds floor when these babies just need a little bit of extra help getting their food and nutrition to their body.
Another thing with Child Life, kind of related to procedural support, is comfort. We want to make sure children are comfortable here, and sometimes people plan to come to the hospital and sometimes they don't. And so for those that don't plan to come, they're not prepared with their special blanket or stuffed animal. And so we like to make sure children have a stuffed animal or whatever it is that will make them feel comfortable, and that they can continue to have these good coping skills while they're here in the hospital and experiencing new things.
With our G-tube doll, we actually have a G-tube book. And so we can go through and look through this. This is actually really helpful with siblings as well. So when they go home and their baby may not be eating by the bottle anymore, instead they're eating from the tubes, and they can read through the book and learn and understand a little bit better that way. We also have diagnosis books. So here's one that is more for a teenager, and it's all about diabetes. It's a comic book, so it's a really cool way to kind of learn about it. And then we also have Spanish resources. In a lot of places you kind of need to have a few different languages book-wise for people. So we have a lot of Spanish resources that we have. And we also use tools like little Dr. Play kits when we're working with these children who are about to have procedures done, or sometimes it's afterwards. Sometimes it's debriefing about the situation that has just occurred. So we can take on our doctor's kits. A lot of times we take in the real medical equipment when they're a little bit older. This is really what they want to see and feel, and really get to become familiar with.
And then another role of Child Life is bereavement. And so we want to make sure when a child is dying that a family is able to create the memories that they want to make. with their child, and the child is able to create the memories with their family that they want to make. And so as child life specialists, we're kind of there as the mediator for the family and for the patient to make sure that their needs are met and their wishes are granted and they're voiced, and that the staff is able to really make sure that all these wishes that the child would like to make, or the family would like to make, are recognized and addressed. And so we do that through a Journey Care program here at our hospital, where we create handprints and molds of patients' hands and feet, cutting locks of hair, things like that, so the family can really remember their patient, even taking pictures, whatever it is that the family would want and the patient would want. We also have resources for the patient, the family, so siblings, cousins, children of the patient if it's an adult patient too, resources for them when they're here in the hospital, and even after they've left, we do a follow-up mailing of various resources for a whole year. And we have a remembrance program here for them too. And I brought a few of the books that we like to use and give as resources to families. And these are all specific, so families who have had maybe a newborn baby die, or maybe a traumatic death, things like that, so that we can really meet the family where they are and provide them the support that they need.
you.